Hey guys, so we are here for Extra Life. We are at Dell Children's Hospital in Austin, Texas, and we're going to do a little walk around and meet some people involved with Dell Children's and see how our Extra Life contributions actually help out the hospital. So hope you enjoy. Katie, you ready for this?
I'm so ready for this.
All right, let's do it.
I'm here with Christy, the epilepsy program manager, and we're in front of this really cool room that we're going to get her to explain a little bit more about.
Absolutely. So we're on our what we call our epilepsy monitoring unit right now. This is a place where kiddos can come and they can have EEGs done. Our kiddos are usually in the room, their own patient rooms, but what we've been able to do is have a wireless system so that the kiddos can actually leave their room and come here to this playroom, which has a lot of different sensory items and different textures and fun lights and things that they can actually play and get out of their room. And that's something they haven't been able to do before until we expanded into this bigger unit about a year and a half ago. So we're very excited about it.
Now we're here with Emily, who is the nurse practitioner, and Kevin, who is the EEG technologist. Very cool title. And I just want to ask you guys a little bit about what you do here in this particular ward and at Dell Children's.
Well, I see the kids every day, check on them and listen to them and see how they're doing. I help put in medication orders, etc. And kind of in the physician's eyes and ears when they're not here. These guys let us know when someone's having a seizure, and then we treat appropriately.
So what we do, me and the techs will put electrodes on top of the kids' heads, and that'll look at the electrical activity in their brains, and then so we watch and see if there's any abnormal activity, and then we talk to Emily and the doctors, and then they medicate based on that.
So we're in the HEB amphitheater here at Dell Children's Hospital. Now this is a place where kids can come where they might be attached to their IVs still. They can all come together, spend some time with other kids in the hospital, watch a clown perform here. I'm not very clowny, but have somebody come and perform here, a comedian, a clown, or they can watch films, have a TV rolled in. I'm here with Dr. Ferrari, who is the director and scientist of the MEG Lab. Do you want to tell us a little bit about what it is that you do and a bit more about the MEG machine?
Sure. Our machine is called magnetoencephalography, or MEG for short.
I'm glad you pronounced that for me because I've been unable to.
Yeah. So what MEG is basically a neurophysiology device, one of the sort of most sensitive sensing devices in the world. And we record the brain waves that are emitted when the brain is working, basically.
Right.
Here at Dell Pediatric Hospital, we use MEG to localize epileptiform activity in patients with epilepsy, and also map functional activity in those patients and also brain tumor patients before they go to surgery. So we have a non-invasive method for localizing function and bad parts of the brain, so to give the surgeons information prior to going into surgery. This technology revolutionized the non-invasive mapping world, actually. There's only about 25 clinical sites in the world in the country, that have this technology, and we're one of 6 pediatric hospitals in the country that have the opportunity to use this technology.
All right, so I'm here with Dr. Mark Lee, who's a brain surgeon, I just found out. And can you tell me a little bit about what you do here at Dell Children's?
Well, I mean, obviously I do brain surgery, but the main thing I do is epilepsy surgery. So this is for children whose seizures aren't controlled with medication. And so we put a lot of effort into trying to find the area of the brain where the seizures are coming from, and then we can actually do surgery to cure the epilepsy.
Cool. And so one of the things that Extra Life helped out with the Rooster Teeth helped out with, was the MEG machine upstairs. Can you talk about how that sort of helps what you do?
That's really very important in what we do with epilepsy. That helps us localize the area of the brain where the seizures are coming from. It's very helpful. Basically, what we do is if we can find a small spot in the brain where the seizures are coming from, we can actually place a laser fiber with computer guidance into that spot, and then in the MRI scanner actually burn a lesion that we can actually see developing in the MRI, so we can be very precise. And the real advantage of that is that the patients actually leave the hospital the next day. And the MEG really helps us localize where we need to put that electrode and the laser fiber to do this.
I'm here with Gina, who has a daughter, Daisy, at Dell Children's. So did you want to tell us a little bit about Daisy's experience at Dell Children's, or your experience as a parent having a child at Dell Children's?
Sure, absolutely. Daisy is 15 years old, and we kind of fell into being treated at Dell Children's by chance, kind of after several years of being treated for epilepsy and autism. And it's been a wonderful experience. We were here last month for a few days and learned a lot about Daisy's condition, and have had the opportunity to meet some amazing doctors and some individuals that are working with her and providing care, as well as working with us on planning her future and making some good decisions. So it's been a really positive experience.
Now we're here with Gwen, this wonderful, wonderful woman. Gwen, do you want to tell me what it is that you do here at Dell Children's and sort of where we are and who we have here?
Sure. I'm Gwen. I'm a nurse, actually, and I'm a manager of the neonatal intensive care unit for Dell Children's Hospital. And I also manage the neonatal transport team. A lot of our babies come sometimes for prematurity, but also for very specialized complex needs like surgery. They have a cardiac problem at birth, or if they are in need of a pediatric subspecialist of any kind. So here's a little baby, for example, who's been with us for a couple of months, and he's more than doubled his birth weight. So he's about
we only
3
saw him
pounds.
2 weeks ago when we came here.
Right. And now he's over 3 pounds about. So when he came, he was just a little over a pound. And you see he's off the ventilator now. He's learning how to eat and grow. And so he's just doing really well. And he was transported in by our neonatal transport team. We have babies who stay here for many months, so we kind of become part of their family at first. We build a really strong bond with the family because this is such an important part of their lives.
I'm here with Roger, whose son Alex is here at Dell Children's. Did you want to talk a little bit about what Alex is here for?
Yeah, Alex, back on August 26th, he was out on a soccer field, and what happened was a stray lightning bolt hit him while he was at his first soccer practice of the season. And this lightning strike caused him to go into cardiac arrest. They then transported him initially to Dell by helicopter. When he first came to Dell, he was still largely unresponsive. So they were working on wound care for the still existing burn injuries.
How old is Alex?
He's 9, yeah, so
he's still growing.
he's still growing, yeah. And the other thing that he's gotten a lot of here from Dell is he's had occupational therapy, physical therapy, and speech therapy, and music therapy. And since he's been here, he started becoming more interactive. He's talking now. Quietly, he is.
Which I bet is a huge relief.
Oh, it is a huge relief. He's tracking us. He's looking around. He's enjoying when we play music he's familiar with. He'll smile.
So, Kip, I was wondering what day would be good to take this back to the office, if that's okay?
No, it's not okay.
No?
Thank you everyone for watching. I hope you learned a little bit about Dell Children's Hospital. We've been working with these guys now for a couple years, and they're incredible. And you can see everything inside is amazing, and what you are doing is helping these people. So thank you everyone who's supporting Extra Life, and if you can, please donate. And if not, just spread the word. Just get the word out there. You know, us gamers, we're trying to do good in the world, and so hope you're helping out. So again, thank you everyone. Thank you everyone for helping out. I know Dell Children's very excited about this, so thank you all, and enjoy the stream.
So Caleb was in the machine. What's your conclusion on that?
Yes, we just finished the recording, and unfortunately, we think there's nothing there.
Nothing there. Doctor says.